How's she been since our last visit?
She's been good.
Yeah?
Yeah.
And you've worked hard with the nutritionist to put on some weight.
Yes.
In our Cerebral Palsy Center, we have 4 pillars that we believe represents the core of care for patients with cerebral palsy. That includes orthopedics, neurology, neurosurgery, and medicine. Cerebral palsy is really a spectrum. There are some kids that don't need all of the services that are in our program, and there are some kids who need everything. And then there's all the other kids who are in between. And so the more involved a child is with cerebral palsy, the more each one of these pillars are vastly important to their care.
Come on, Max. Show us how you can do it. Good boy. There you go. There you go.
Many families have been to the hospital many times for different conditions associated with cerebral palsy. So we try to make things as smooth and as clear for families as possible.
We have one major phone number that families can call, and we have a program coordinator and an assistant for scheduling, and we have a nurse practitioner who works under cerebral palsy.
We provide a multidiscipline care for these children with cerebral palsy, and what that really means is that simultaneously they're seen by an orthopedic surgeon, a physiatrist, a neurologist, and sometimes even a complex care doctor.
Every patient is different with cerebral palsy. It takes this group discussion with everybody in a room together, bouncing ideas off each other, revising our plans to make them the best we can be, and that work of the team is so much greater than one person operating in a silo trying to take care of the children.
Yeah, she does have a lot of that tightness that comes and goes that we call the dystonia. So we will see an improvement in that right after surgery.
We're excited about a number of different things that we're doing to try to improve the outcomes of patients with cerebral palsy. And as neurosurgeons, our job is to try to decrease the tightness or tone that kids have in their arms or legs. A collaborative group of physicians here at Boston Children's all work together to help decrease this tone for patients.
The surgery options to me are amazing. You can put in an intrathecal baclofen pump. You can do a selective dorsal rhizotomy, deep brain stimulation. How you decide which patient needs one of those, that's where our center comes in, is to make the best treatment plan, and then the infrastructure is here to execute that plan. That does not exist in every other hospital.
We are attracting the most complex patients throughout the world, and so our patients and families are always challenging us in the clinical side to do our best to not shy away from taking care of them, but to really embrace these kids and their families. And it's such a privilege to be able to work closely with families in that endeavor.